All right, we still have a few people joining. We'll wait 30 more seconds here, see if we get a few more folks on. All right, let's go ahead and kick off. Thanks everyone for joining today. My name is Matt Murren. I'm the CEO with True North ITG. We're a healthcare IT provider, and some of you folks are current customers. Appreciate you joining. Recently, with the whole COVID-19 situation, we've had a lot of our clients that have been asking us how other organizations that we're working with are not only adjusting and analyzing their operations, both financially and technically, both customers and prospects, very interested in kind of a perspective on what others are doing. And I asked Larry Jurgens, who's been a long-time associate in the healthcare industry we worked with for many years, from Clifton Allen, to join us today to talk about some of the things that they're doing with their clients and ours, but also just trying to give a perspective on different kind of analytics perspectives and metrics that are using in plans in these crazy times. So with that, Larry, thanks for joining us, and appreciate you sharing some of the information that you have.
Absolutely, yeah. Thank you, Matt, and thank you for everyone in attendance today. This is just a time where, I think it's important under these unique times to share and be very transparent of how other groups are handling each situation and what tools might be available out there, as we all have been stuck in our houses and trying to figure out like how we open our doors back up. And so what do we have put together is some slides and some ideas, and just to really want to have an open discussion. And please use the chat section for asking questions. Matt and will interject some of those things, and we actually have some polls as well. And so with that in mind, I want to share some of the things that our clients that I get to work with across, from coast to coast, and there's been the difference here across the nation of the different approach where, there are elective surgeries, for example, happening now. Other places are completely closed down still, and then some states are just now getting into the restriction portion of it. So please just ask away, and we just want to make this the first of 3 parts. The focus right now in this one is primarily going to be the financial planning impacts of that, and we break it out. I like to look at it this way, in terms of, yes, it does present an opportunity. Try and take a look at things at half full here. There's financial, operational, clinical performance, and there's going to be, and there are already, lots of financial implications of COVID-19. And whether you're a primary care doctor's office, pediatrician, OB, any kind of specialties, ortho, or even hospital. And we work with a significant amount of nursing facilities. Everybody is getting impacted on this. And so we want to talk a little bit about that. And we're going to have a poll in the next portion of it. They're going to ask you on what impact that you have experienced before this kind of what we're saying the new norm is. And we're going to leapfrog from that and start to talk about patient demands and backlogs and capacities, what financial implications with telehealth, all of that good stuff. So I'm going to kind of step back a little bit, and this is the reality of kind of what we all kind of feel. It's truly 7 stages. It's just 24 years of being in healthcare and healthcare management and consulting. Never have I seen it at this level, and I think all of us can say that. Very unique, and so this is more the personal side. I know we're touching base on the financial side, but this is more the personal side of it. And it's something that we, and I could talk a lot about our clients in terms of, their staffing models and how they're significantly going to be changing all of those and being accommodating to, stay-at-home parent as well. So it's definitely impacting different specialties. This particular on our screen here is we're showing what Commonwealth Fund just later last month, is the number of visits by the physicians is really down, and by specialty. So I'm sure that you recognize some of the specialties of your own practice on this list, and this is where we will like to poll you. And if we could just bring that poll up now, this is where I want to make sure that we're addressing what significant level of impact has COVID had on you and your practice. So before we get into the new normal of operating and opening your doors up to patients, what kind of volume reduction have you seen in your patients since the closure? So if you wouldn't mind taking that poll and answering that, and then I will, and then Matt will give us the results here shortly, that would be great. Because why we ask this question is there's been the differences in practices that how they reopen or consider now. I think in the next 4 to 6 to 8 weeks, in the consideration of opening your doors back up, there's been a very significant difference between those that are going to answer D versus B, for example. And the new normal is looking dramatically different from those. So Matt, do we have results?
Yeah, I apologize. It looks like the poll didn't fire off, so we'll have to step forward to the next one.
Okay, no problem at all. Why don't we go ahead and we can, we're going to talk about that, and if we can get those working, then we definitely will. So here's the process and approach that we had suggested, and how we have been looking at things in terms of evaluation of services. It's very medical group specific, I should say, and I apologize, it says client specific, but basically that's a specialty specific. Each of you have been impacted, whether you have a surgery center attached, or you're doing behavioral health or primary care. If you are dependent on a referral source and you need orders produced, you're all been impacted in a different way. And then we do have a suggestion. It is around data, and this is where I say that we have to be all very careful what we share. But you're referring providers, if you're a specialty, absolutely now's the time to reach out to those referring physicians and be ready for, whether you believe it's going to be just this onslaught, huge demand for patients, or you're thinking is going to be ratcheted up, over time. It's just a matter of planning that for yourselves. And then, of course, for all practices, that data and number of patients that are sitting out there and wanting to get in, they just need to be more confident. They need to know what's going on. They will be coming in, and how to handle those. We have an opportunity I'll show you later down the road here is just doing some modeling. We want to, let's say you have a budget that's set for 2020 prior to COVID. Well, what has been the impact to COVID? And let's model that out. And then we should do some scenarios in terms of, are we going to see revenue increase 20% the first month, 40%, 120 in a matter of 6 months maybe? Do we want that? Do we need that? What should we be prepared for? We have had lots of clients, I'm sure included on this webinar as well. You all have furloughed folks out or have laid people off. He dramatically had to make some tough decisions in this market, and you're going to rebound. But then, what has been the financial impact of doing that? And is it enough? Have you gotten your PPP money, your HHS money, all this other SBA, excuse me, whatever funding that you have had, and then doing a modeling of how long will that last, assuming the patients are, when we are opening our doors back up, and then obviously having contingency plans for that as well. So Matt, just to chime in here, we have another planned poll. Is that going to be available?
Yep.
Okay.
I got it. You want me to launch that now?
Yes, please. Yeah.
Okay.
So along those lines, if you are looking at, please complete the polling. If we're looking at some analysis and that data, and you're doing some, planning and your modeling, I wanted to find out kind of where you are, meet you where you are as it relates to how much financial and modeling analysis have you had. So I defined it as A, significant. So you've projected revenue, expenses, staffing, all on multiple variables and scenarios. And then B is moderate, and then and C, minimal, is really no projections, but you're monitoring those key metrics, meaning your cash, your liquidity, you're monitoring the bank, your revenue, where your AR is. And then if you haven't been able to do any financial modeling or analysis yet, D is that. All right. I'm going to go off to the next slide, and then Matt, you can chime in, please, when you have the results of that. So we're going to shift gears in terms of what we're looking at here is the impacts to your clinic. And we're going to talk a little bit about what to do next and what others are doing as well. And I think the significance of there's a lot of ideas, and it's still fairly early to know if your idea is good or bad, or maybe it's just neutral, or is it working or not. And that's the, we're all kind of like, that's the importance of sharing. And so I think the biggest question I like to ask is, let's say that we are experiencing a drop in patient volumes by 70%. And then now that we're considering opening our doors back up, what would be your ideal by year end? Let's start to put a goal together. And are you break even? Well, what's it going to take to do break even, both from a revenue standpoint, patient volume standpoint, and expenses standpoint? I'll speak to my company is that we have absolutely cut out so many expenses that we typically would have had, not just travel, but then our benefits. And then we have had to take a haircut in our salary, for example, all in the best interest of the greater company itself. Is that going to put us where we need to be, knowing that we are going to recover from all this? Do you have a plan for your capacity? So if you have been closed, I'm in Seattle area, if you have been closed for 6 weeks, you know that the patients are out there, they will be coming back. Do you have the capacity? Is that, and if not, what is that capacity? Is that greater than, let's say, 2 hours a week in the evenings, or is that a full weekend, or by provider, or by modality? Do we have certain administrative barriers that we've had in the past? And are we now able to address those and find increases in productivity? And what I mean by that is that, when it comes down to staffing, it's going to come down to the social distancing and number of patients, the room turnover, in terms of, can we see as many patients as we used to? So really a matter of the downstream is that, as you're starting to see patients, will you have the availability at the, let's say the OR at the hospital? Do you have the availability for an MRI to be completed? Those are the things that we, our patients are going to definitely be interested in take a look at. And we're going to dive into that in the other parts of these presentations as well. So talk a little bit about what our groups that we get to work with here is that after you start asking the questions of how much, when, and for how long is this going to be occurring, we've really started to work with them and honestly just listening to them and finding out what kind of contingency plans are we doing? Are we, and just not to read the slides here, we have many groups out there that basically and said, look, this is a unique time. We're going to reduce, if not eliminate, some of the spending and possibly change benefits on the fly here just because we have to. So I think the spending portion of it, kind of a no-brainer, but is, what impact does that do to our bottom line? Workforce reduction. We have to be very careful with that because, this is deep cuts for a short period of time, we believe, and I want to know kind of what's out there in terms of if you have questions, and I want to know what you're experiencing as well. I think across the board, I think capital spending, with the exception of some practices, they're absolutely put a freeze on this. They're not expanding, and then delaying any kind of hiring as well. And that is, it's a jeopardy situation, especially around providers. A lot of our groups that were initially contacted us is saying, look, I had all these providers that I was going to bring on in the first quarter, and then or second quarter, what do I do? Do we do it or not? And how do you make those decisions? So try to, and I'm going to show the modeling as I mentioned, but in terms of evaluating your financial impact, and I'm curious to see what you all have done in terms of this. This is just an example in terms of how I look at it and how our group looks at it, is that we know that revenue has dropped. What is the size of the dip, and and what is considered, and what does the surge in turn look like? And that way you can try to do the recapture of your patients and the elimination, in essence, of revenue. Unfortunately, we've had some policy and governmental assistance on that, as well as maybe you have lived well via collection of your AR, and we can absolutely go from there. And but no matter of what happens after that, we're going to have this little pinch. And what do we have a model in place for just talking about what happens in, let's say, August? And so this is the modeling that we have gathered up, and in fact, what I'm going to do, I'll go through some more slides. I'm going to show you a screenshot of the model, and then we can absolutely do a real live demo of the model as well if we wish. So what are groups doing now as they have this new normal of operations and financial situation going on is that I think that they're taking a financial look at the operations, and so do they have enough capacity under these unique challenges to open up their doors, and what does that look like? Are they going to see still the same dollar per encounter, or is it going to be less, or is it going to be more? What I mean by less is that you're going to I have a lot of groups that are going to continue to use and planning on using telehealth, which is really a great idea. Yet there is a financial impact if that's going to be a provider, or, what type of provider. Are you going to use advanced practitioners? Are you going to use a physician, or some types of RN capacity as well? So, and what type of, how you're going to schedule those, monitor that, and absolutely the revenue cycle component of this is just huge. It's been turned on its ear in terms of what we can bill and how to bill those, watching your diagnosis, and then your quality measures. We're really curious to see how all of that turns out for 2020 as well. The availability of staff is something that people are now planning on, and some real examples of this is that we have had groups where they, through modeling, said, you know what, we're going to have to open up these hours. Instead of an 8-hour shift, we need a 12-hour clinic day. Well, it's very difficult for our staff to be here for 12 hours. So because they have kids at home still going to school. And so one example here of what one group did is said, we're going to split this out through conversations with their staff, and said, look, we're going to have to, break your day up into different chunks throughout the week. And yes, you'll get your hours, but you can only be here for 4 hours or 6 hours at a time, but we want to be open for 12. And then it was really a collaborative effort on their part. And honestly, what happened is that they really reduced the dollar amount as well, because overtime was handled in a different way. And honestly, you're accommodating, and you're building a lot of loyalty in their employees as well by doing something similar to that. And so from an administrative standpoint, this is a challenge because you have administrators and leaders running the day-to-day part of your clinic. And now all of these things that have to be done, you got to plan on doing them 4 to 6 weeks in advance. What's their availability, and how much focus can they do on that while they're on today's work, doing today's work? And so that's been a challenge, I think, for a lot of different practices, because you're trying to do today's work today, but you need to do 2 weeks from now's work in planning right now as well. So going on to the model is that, and I hope everybody can see this fairly well. And I'm not promoting this is called Intuition 2.0. It's just a model where we have taken the balance sheet and the profit and loss of a practice, and also a hospital or nursing facility or whatever. And we have put in here what your budget was, what you're experiencing the dip to be. And in this example, it says, the dip were reduced by 60%, and it started on March 15, and we believe it's going to last through May 31st. So that is a significant drop in our revenue, and you can see that in the very bottom of the graph. It goes from March to May, and then you have this recapture recovery rate where we believe we're going to be recovering over the 60-day period 90%. And so that's from, you can see where the dip starts to change right at May, June, all the way up to July. And this particular practice, their original revenue was $54 million. Their adjusted revenue right now under these scenarios, I'm on the very top here, is 47 million. And then it also calculates your margin and your liquidity. So these are just some very key KPIs, if you want, or metrics that we had suggested to track, and just making decisions around. For example, the yellow bar there is the non-labor reduction. So the assumption here is that we could reduce by 10% those non-labor reductions, and we're going to do it for a period of months, and you can adjust those. And these are all real-time adjusting toggles. Then you have this discretionary benefits if you're allowed to do that. Under certain contracts, we find that you can't do that. And but this assumption here is saying, yes, we're going to absolutely get all of our discretionary benefits out, and we're going to cut that. What does that financial impact mean to us? And then so on and so forth. You can go right into all of the other components of this, and I'm going to leave some time, perhaps in the end here, to really demo that. If not, I can send you a hyperlink so you can play around with the actual example that I would be showing anyway, and you probably have already done some analysis and some modeling like this, but we do have that out there, and you can just pick some ideas out if some things that we've been thinking about on our website. But the model is there for you to play around with, and we have used the Microsoft business product for that as well. So where financials meet operations is through management. And this is what we're trying to talk about now with our, part 2 of the 3 here is, in this phase, the decisions that we're making now and knowing what we want by the end of the year financially and what we feel like our financial needs are, that's where we can start to talk about different scenarios and how do we completely recover by year end or whatever time period you set. And it's just around the financial results will be determined by the management and execution of decisions. And so sometimes you want to delay those. It's just a matter of bending the curve. Means over the next several weeks, we might make decisions to delay things. We might make decisions right away, and so it will be a faster recovery of that. Some of the things that are just wanted to talk about here is that the initial response we see from a lot of different groups are telehealth, the implementation of the telehealth now, and they already have that, and they will continue that. What does it look like? Those decisions, if you're making them now, will absolutely benefit you when you get into June, July. And the accommodation of non-elective patient demand. And can we accommodate that? What does it look like? We have another model that's doing patient demand and capacity studies, and actually, how do you schedule your patients? A lot of our groups are saying, look, we're going to call they're going to stage them. So the problem list patients will be out there, and you will be able to see the problem patients over the ones that are routine or annual types of visits as well. The integration of patient care teams, huge change in thought and process. Working with physicians sometimes it's not been a favored part of it. Like I'm going to see my own patients. I don't want anybody else to see them. I think this is the opportune time to basically say, look, for quality and for accommodating the patients, this might be a different way of looking at how do we do the pre-visit planning with kind of queuing the patient up and getting the patient seen in a most effective way, in essence. The most effective way also is we see those groups that are really proactive right now are adjusting their appointment system. They're making it very streamlined around how the patients are coming in, very accommodating to the patient, not necessarily in the past, perhaps it was all about the provider. So, you know, I think it could definitely work. It's a matter of how you're going to see patients as quickly and effectively as possible. Patient communication is a huge one right now. Is, you know, as I mentioned right at the very beginning, there is that do you have the ability to communicate with your patients? We have groups using their text messages, their social media. They are alerting their patients is saying, you know, when you do come in, you know, please wait in the parking lot and we will text you. Is it okay to text you? And when the room is ready, because, you know, between the social distancing and the patient's safety, that's one component. Also, do you mask or not mask, and how do you handle that? And so what cleaning and disinfecting protocol did you put into place? Those are the types of things that people are now interested in before they come and see any clinics. The other one is just managing staff situations, as I mentioned. You know, that is a component that is ongoing, and I'm really finding a lot of staff and management being accommodating for each other under these circumstances. The model that I mentioned before, so we took a look at the financial model, and then this is the management modeling aside from that, but it really has a financial component to it as well. What I mean by that is that let's say that we have in this example, a $1.198 million deficit from the financials. What's it going to take if we want to basically break even by year end? If we're going to need to look at changing the office hours, you know, number of providers available, do we do changes in the provider schedules, the scheduling changes that I mentioned before? And then are we capturing any type of additional revenue cycle opportunities? You know, this is a touchy one, depending on where market you're at. We have, you know, are you collecting more money or less money up front? And, you know, do we need to plan for that? Do you have new financial agreements with your patients? How effective are we with verifying their eligibility prior to them coming in? Because do they have coverage? Is it under COBRA? All of these components, it could delay the collection of funds. But then, you know, how are we doing in terms of denials as well? So those are the types of things that absolutely highly suggest working on and looking at now in preparation of reopening, and also and you know, prior to seeing a higher volume of patients. And that's really the plan, right? Is that if we're going to bend that curve and get beyond, and I think it's safe to say that we should probably plan on anywhere from 120% of our typical patients capacities to maybe 150, and different areas of the country that could last a matter of weeks or months in that. And I know that's a general statement. Um, to take a look at it and break it down into different components and shorter periods of times is that, phase one, preparing for that reopen. Phase two is reopening and doing that catch up. And then what is phase three? Phase three will change over time, but it's really the new normal. And I don't know if any of us really have that. But from a time standpoint, it's really, I would say, you're talking about phase one being anywhere from today, and some parts of the country is end of April. It could be end of May here, all the way to probably June, July, and then another, phase two is, in that July to August, September, and beyond that. So different scenarios as well. Some folks believe that we're going to have a resurgence, and how do we plan on that? What does that scenario look like? So now we're going to talk a little bit more about specifics. So in terms of, communication with your patients, and there's lots of great little technology and tools out there that we can utilize and that are getting utilized around communication with patients. As I mentioned, I think that everybody's a little bit on alert. And so, these are the components that we see most commonly asked across some of our clinics that are now opening their doors. What are the hours? Infectious control, the visitor guidelines is huge, in different types of specialties. Do you wearing your mask, your protective, those types of things. Communicating all of the, how are we handling payments or not? And some of them, I have a client that used to collect a lot of cash, and they said, we're not going to collect cash. We're actually going to go cashless. And they'd still do the credit card, but they just are not utilizing cash any longer just because of the COVID. They don't know if it's going to be for a short-term or long-term situation. So track the and ask in terms of every time you get a phone call, I think is an opportunity to just listen to your patients and ask them, like, how are they doing? How do they prefer? Where do they want to get their information? They're getting inundated, but perhaps it's through a patient portal. It could be that. And so just asking that and keeping track of it as well in your practice management system, or if you have a patient access system as well, that can accommodate the capturing of that. It's not just from a marketing standpoint, it's really a truly a patient service component as well. And then if you haven't been part of this, there are patients out there that they don't feel like they're safe, and they will go on social media or whatever it is and just be highly concentrated and focused in on capturing those and finding out why they're doing that, and then handling the public negativity. And if any of you are part of a hospital, you may have been in the newspaper already, and it's unfortunate under the circumstances. So revenue opportunities on this whole recapture. As I mentioned, the blending of telehealth visits. We have had a lot of our, several groups, I should say, have adopted telehealth, and in that different scenario where they have seen a 60–70% reduction of patients, they actually have recaptured that within a matter of weeks of standing up a telehealth system that that at least can start to accommodate, the patients and see them with this somewhat more relaxed telehealth environment that we're all in. And then now it's a matter of that's the charges, and then are you getting accurately paid for those, and what's it going to take? And we've also feel as if the types of patients as you open up will be important to see the patients are the problem ones, getting those handled and accommodated. I have a client that had 5 different locations throughout a metropolitan area. And they chose to say, look, if you don't have any systematic problems, and we're going to ask you those over the phone, is that you go to this location, and if you do, and then you go to this other location. And they still are doing any type of temps before the patients are coming in, but they really did accommodate a lot of fear-based problems at that point in time. So again, the communication and then again the communication with patients, availability of workforce as well. So just to accommodate this last slide here is what we're finding out there is the change management that we have known and maybe exercised in our career has been almost like dog years is how I'd describe it. And so an hour is a day now, and a day is a week. And so how are we effectively communicating this to our staff and to our providers? How are we effectively, all of these decisions that we're making, how are we effectively, efficiently communicating to our patients? And then how are we going to evaluate the decisions that we're making? Were they the right ones and or wrong ones? And so and how are we going to track it? And the financial implications of a new and future practice environment. Are we going to see the same margins that we used to? And if not, then we should plan for it or need to make further changes in the way we practice medicine. One thing that from a financial standpoint that I think that it's fascinating, and you may have been experienced this as well, is that the medical supply chain has really been difficult, let's say, and is that changing the overhead and to see patients as well. So so in closing, really a matter of you have a great set, lots of different resources, and under unique circumstances, reopening, and you have the scenarios, and then when the rubber hits the road, as they say, when the patients are starting to come, do we have things put in place that we accommodate, whether we're talking about, we can only see 40% of our patient load or 150% of our patient load. We're kind of prepared for all of those different scenarios. So Matt, I want to kind of open this back up and just to see what questions you have received or what questions that we might want to talk about.
Yeah, I think some of the telehealth pieces we're going to cover in part 2. I guess one of the questions is the URL, so folks can kind of look at the demo for the product.
Yeah. Do we have to? Do you want me to take a look at that? We can take a look at now.
No, we can send that if you want to type that in the chat window for everyone, just the URL as we wrap up. So appreciate everyone joining. This was, as we said, this is part 1. Part 2, and thanks Larry for joining us. Part 2, we are going to be focused on really the recovery aspect and innovative ways folks are using telehealth, the types of workflows they're using, leveraging telehealth. A lot of our customers, obviously everyone was forced to rush into telehealth. So a lot of our customers have taken kind of a short-term, long-term approach. So we kind of want to provide our view in different, not only products, but and workflows that we're assisting our customers with, just to give everyone another perspective. But we're also going to weave in some of the interesting new technologies around scheduling and more intelligent scheduling to make sure that you are maximizing the load of your schedules, based on some of the models that Larry talked about. So we're excited to go through some of those real case studies and tools that we're working with clients on, leveraging technology. Obviously, we're a healthcare IT company. So we'll continue that series. And then in part 3, we're going to be covering the mobility aspect and how our customers have moved their employees at home, some of the technologies they're leveraging. I know a lot of you are leveraging those as well. Just to give another perspective of trying to keep this in the vein of lessons learned. This is a real-time situation and everyone's having to kind of assess things as we are on a daily basis. So we're just trying to share other views that we're seeing as we consult and implement different technologies and workflows for our customers. So I'm excited for part 2 and part 3. This is recorded, so if you had staff or peers that could benefit from this series, we'll be sharing that recording, and so everyone can send that out. So obviously everyone on the attendee list will receive that as well. So it looks like, Larry, you posted the link here, so
yeah.
everyone can.
The only option, Matt, I had was to organizer and maybe panelist. So if you wouldn't mind sharing that out to everybody, the attendees, and I have it on my screen here right now as well. But the trick here is to expand this, and then it becomes a fully functional model for everybody. And again, just food for thought in terms of different ways that we're going to get out of this COVID, and what financial impacts that you might be experiencing.
Good. I'm going to go ahead and unmute if anyone has any questions as we wrap up. Any questions that Larry can assist with? All right, perfect. Well, we will send the recording. Appreciate everyone joining today. Hopefully everyone got some tidbits of maybe a perspective that you hadn't looked at. Hopefully you find the tools useful. Certainly send a message if you have any other questions we can follow up on, and everyone have a great weekend. All right, take care.